Hey, so all welcome back to my YouTube channel. Today we are going to discuss about the rest of the triangles of neck. In the last video I have discussed about the anterior triangle of neck, and this time we are going to discuss about the posterior triangles of neck. Okay. As you know that this is the sternocleidomastoid muscle, and this part is the superior belly of omohyoid and this part is the inferior belly of the omohyoid. So this triangle is our posterior triangle. Okay. So posterior triangle is divided into two parts by the inferior belly of omohyoid. The upper part is called as the occipital triangle and the lower part is called as subclavian triangle. Subclavian triangle. So first of all, let's begin with occipital triangle. Okay. Occipital triangle. This is the occipital triangle. You can see it carefully. Okay. What are the boundaries of it? Anterior to it, it has posterior border of sternocleidomastoid muscle. ठीक है. Posterior to it, this is sternocleidomastoid and this one is the trapezius muscle. Okay. So posteriorly it has anterior border of trapezius and inferiorly we have medial 1/3 of clavicle. Okay. And the roof is formed by investing layer of deep fascia and the apex of it consists of sternocleidomastoid along with trapezius muscle. So here you have to remember the roof. You can label the boundaries by looking at the diagram. This is the anterior part, this is the posterior part, this is the roof. Okay. Anteriorly we have the posterior part of sternocleidomastoid, posteriorly we have the anterior part of the trapezius, and inferiorly we have the medial 1/3 of our clavicle downwards. Okay. Then at the roof we have the investing layer of deep cervical fascia, and the apex involves the two muscles, that is sternocleidomastoid and trapezius muscle. Then what are the floor contents? Okay. You should remember at the floor we have, it is important to remember, splenius capitis, levator scapulae, anterior of scalene and middle scalene. This all of you should remember. The floor, it consists of splenius capitis, levator scapulae, anterior scalene and middle scalene. Last two you can remember and first two you should memorize again and again to remember it down. First of all, it consists of splenius capitis, then it has the levator scapulae, then it has the anterior scalenus and the middle scalene. Okay. Then we will study about the contents. All of the rest of the things are same for the subclavian triangle, and the difference in between them is shown in the contents. What are the contents? We will study simultaneously. Firstly, we will study the contents of occipital triangle, along with this the subclavian triangle. Okay. First of all, we will study what are the nerves of the occipital triangle. The nerves involved in the occipital triangle are cervical plexus, while the nerve involved in the subclavian part is brachial plexus. Brachial plexus. You should remember, in the occipital part it is cervical plexus, and in the case of subclavian triangle it is brachial plexus. If you find it difficult, you should remember, like there is something called OCD, na? So ONC, that is occipital triangle involving the cervical plexus, and you can remember the subclavian triangle, that there is a bank called SBI, subclavian triangle with the help of brachial plexus. You should remember like this. Okay. And then what are the things that are involved? What are the nerve supply? Firstly, I have told you about the cervical plexus. What are the contents in the cervical plexus? It involves lesser occipital, greater auricular nerve. Okay. It involves anterior cutaneous nerve of neck and supraclavicular nerve. 1, 2, 3 and 4. What are they? Firstly, they involves lesser occipital, greater auricular, anterior cutaneous nerve of the neck and supraclavicular nerve. Okay. Basically involving C2, C3, C4 and C5. It involves the cervical plexus. Along with cervical plexus, it involves spinal accessory nerve. Spinal accessory nerve. Okay. Now what about the brachial plexus? It involves brachial plexus. Along with this, it involves 3S. What are the 3S? It involves suprascapular, subclavius and serratus anterior and serratus anterior. Suprascapular nerve, subclavius nerve and the serratus anterior nerve. It involves the brachial plexus and S cube. Okay. I will make you understand this properly, so please show your interest to this. What are the nerves of the occipital triangle? You should remember with the OCD. OCD, O is the occipital triangle and C is the cervical plex, and for the subclavian triangle you should remember the bank SBI, subclavian triangle along with the brachial plexus. So occipital triangle involves the cervical plexus involving the 4 branches to it, that is the lesser occipital, greater auricular nerve, anterior cutaneous nerve to the neck and the supraclavicular nerve. And to the suboccipital triangle we have the brachial plexus, and the 3S involved are suprascapular, subclavius and the serratus anterior. Now what are the arterial supply? Arterial supply to the occipital triangle is by the occipital artery and with the help of transverse cervical artery. Sorry for my writing. It involves the occipital artery and the transverse cervical artery, while in the case of subclavian part, it involves subclavian artery and suprascapular artery. As the nerve names are, so the arterial names, so you can remember them easily. What is the venous supply? It is with the help of external jugular vein, both of them. Sorry. As this mechanism, vein supply is also like the arterial supply. Okay. So this is all about the posterior triangle of neck. I will revise for all of you again. Boundaries all of you can remember. You should remember about the floor involving the 4 muscles, that is called as splenius capitis, levator scapulae, anterior scalene and the middle scalene. Contents you should remember about the nerve supply, arterial supply and the venous supply. Nerve supply for the occipital triangle you should remember with the word OCI. C is the cervical plex. Cervical plex involve the 4 parts, that are lesser occipital, greater auricular nerve, anterior part of the cutaneous nerve to the neck, and to that of the supraclavicular nerve. And to that of the subclavian we have the brachial plexus from the SBI, and it involves the 3S. They are basically suprascapular nerve, subclavius nerve and serratus anterior nerve. Okay. Then what are the arterial supply? It is with same occipital artery and the transverse cervical artery, and for them it is the suprascapular artery and the subclavius artery. And the venous supply is, as the name suggests, for another one it is external jugular vein. Okay, so this covers your posterior part of neck. Whenever the question comes for your theory, you should always draw first a diagram. By looking the diagram, you can write all of its boundaries. Okay, so watch the diagram carefully first, then only you can understand what are the boundaries and its contents you should remember thoroughly. So just this is all for today's. Please do like, share and subscribe to my channel. Thank you for watching.